From NBC News, this is Today with Katie Couric and Matt Lauer.
Thanks, Al. This morning on our special series, Life After 40, the topic is how your face ages and what you can do about it. As a woman hits the big 40, she may start to see some wrinkles and sagging when she looks at her face at the mirror. But one increasingly popular way to turn back the clock is plastic surgery. And Dr. Derek Antell is a plastic surgeon here in New York City. Doctor, good morning.
Thank you.
Now, I've got to tell you, I am a hard sell. Like a lot of women listening right now, I'm thinking, you know, why mess with what God gave me? Your answer to that?
I agree with what you're saying, and I think that for some people, plastic surgery is a way for them to improve their appearance outwardly, and it buoys their spirit. It's not just to please the eye, it makes people feel better.
Let's take a look at why some women feel worse as they age.
Yes.
We've got a picture here of a woman in her 20s. And how is she aging by the time she gets to in her early 40s?
Well, as we look at these two pictures, may I walk over
Go
here for a second?
it.
This woman still looks fairly youthful. Her skin is taut. Her eyelids are tight. But what happens is people will sometimes say, I'm starting to look like my mother. And patients will come in and they'll point out things to me, such as their eyelids getting a little bit puffier, or the lower neck gets a little saggy, they get loose skin. The fold starts getting a little deeper in this corner, and from the corner of the nose to the corner of the mouth, this area gets deeper as well. But probably the first changes are in the areas of the eyes. A crease develops between here, and the forehead starts to drop down.
You mentioned the first area of change being the eyelids, the eye area. You have pictures of a procedure.
Yes.
Tell us what actually happens in plastic surgery here.
This particular patient was about 42 when she had her surgery done. She has some puffiness around her eyelids on both the upper and the lower eyelids. Some extra skin was removed and fat from both the upper and the lower lids. It allows her to put makeup on her upper lid now. You can now see her fold. This type of surgery is done under local anesthesia as an outpatient. That means it's often done in an office setting, and the people go home afterwards. It's done with just a little bit of a relaxant, sort of a Valium type of anesthesia.
How many days again, the recovery time?
The recovery, there's some bruising for about 5 or 6 days. There's some sutures that are removed at about 5 days. Most people return to work within 8 to 10 days.
Let's take a look now as a woman ages. What happens by the time a woman gets in her later 40s? You talked about things starting to sag. Well, in this picture, in a matter of just a decade, less than a decade, a lot of change.
Well, what's happened over here is there's further aging. The eyelids have gotten more puffy. The fold begins to deepen. You get some extra fat under the chin area, and there's cords that develop as well as loose skin in this area. This tissue can be slid back and repositioned to correct these problems, and the fold in the upper eyelid area gets deeper between the eyebrows as well.
A lot of women are afraid of actually getting cut in the neck area, where a lot of women are concerned. Liposuction is a less invasive procedure, isn't it?
Yes, and liposuction is a good alternative in this area if there's just a little bit of fat and if the skin hasn't lost its elasticity. But in many cases, if the skin has lost elasticity, you need to actually tighten it up and lift it back up as well.
You talk about elasticity. You know, I'm wondering if that says something about when we need to get these surgeries.
Well, most patients that I operate on end up saying to me, I wish I'd done it sooner.
How soon should we do it?
It depends on how you're aging, but I think that in general, people that have it done when they see the signs of change, which usually occur most rapidly from 40 to 45, those people that have it done then will always have an edge over people that do it perhaps in their 50s, because it'll look more natural, they'll look more arrested, and good plastic surgery is that which you cannot tell.
You mentioned good plastic surgery. You know, we've all seen bad plastic surgeries. I mean, some of it just looks absolutely just weird. Besides that risk, are there actually health risks as well?
Yes, it is surgery, and that's not to be forgotten, but the risks are minimal. We operate on thousands of patients. In our own practice, we have operated on many doctors' spouses, including several plastic surgeons.
Well, talk about these risks, though. I mean, we've all seen them. Women we really get scared by when we see them, and we know it's because of plastic surgery. How do we not get ourselves in that position? How do we find the right doctor?
That's an excellent question, and I think the most important thing in terms of getting a good result is starting with the surgeon. You should look for someone who's board certified in plastic surgery. I devote the majority of my practice to aesthetic plastic surgery because we recognize how it buoys people up. You can contact the American Society of Plastic and Reconstructive Surgeons, which has an 800 referral number, and they also have a website which is available.
And they'll tell you how many surgeries, for example, the surgeon may have had, so that you get an idea of the experience.
Yes.
All right. Dr. Antell, thank you so much this morning for joining us, Mr. Fountain of Youth.